Everybody, we are here. We are here with Dr. Rob Silver, one of my favorite people in the world. And I want to tell everyone that Rob and I go way back. We go back decades to when we first met in Atlanta at the acupuncture course. Back then, there was no Chi Institute. It was just the International Veterinary Acupuncture Society, and they're still active today. And Dr. Rob and I were running partners way back then. And
It was
so
1982, I think, wasn't it?
I think it was 1993. I'm guessing, but you might be right.
Well, we got our
Um,
we got our certification in 93, but I think the course actually started in 92.
okay, yeah, so there you go. So, Dr. Rob, why don't you tell us a little bit about yourself and what brought you to the world of mycology, of these amazing mushrooms that we have seen help our patients so much?
hmm Well, I'm an integrative veterinarian of over 40 years practical experience. I'm currently retired from practice so that I can work on educational materials and actually to work with a mushroom company to develop, really effective products for pets. So I was for a while in the cannabis space, and I'm still quite knowledgeable in that era. But mushrooms really have been having their moment these last 5 years or so. And they're amazing. They have amazing properties that we'll discuss here. But there really were not very good products available until about 10 years ago. And so, you know, raw mushrooms or dried mushrooms, they all need to be better processed in order to improve absorption. So once there was a company or several companies that were creating, mushroom products and capsules and powders that would be applicable to pets. There weren't any real pet products yet. That's where I saw an opportunity to work with this large Canadian mushroom company to create a line of pet products, just as I had done for the prior 25 years when I was with RX Vitamins, which is a veterinary nutraceutical company that I formulated all 40 of their products. So I'm just totally enamored with the incredible health value of mushrooms for so many important reasons that our pets need to have them, and the bottom line for kind of all of these reasons that mushrooms work is that they really can contribute to pet longevity and to an increased health span. And the health span is the period of time that an individual, a human or an animal, is alive, that they're also healthy. Because, once you get sick, it's it's part of your lifespan, but it really isn't part of your life where you're most happy and optimally effective. So mushrooms have a lot of benefits, and I'm happy to chat about them. It's my favorite subject.
Yeah. Well, I have had just some cool experiences with them. I mean, even just like cooking shiitake mushrooms, there's a lot of research on them, isn't it? Even I kind of went to PubMed once, and it was like Grifolia, I think was the name. Maybe I'm not saying it right, but and I thought, gosh, we try to eat those like 3, 4 times a week, just cooked. Is that the best way to like sort of make mushrooms? Is to cook them? Like if you were just eat them just as mushrooms, and then do you like them or do you like other kinds of mushrooms too?
There's a lot of research into shiitake. I think the amount of research is comparable to the amount of research that we see on ginseng and garlic and echinacea. And shiitake, as tasty as it is and as easy to find at many grocery stores, it is powerful in terms of its immune system and metabolic benefits. It's a very tasty mushroom. It's one of my favorites, and it's generally much more accessible than some of the more um, gourmet mushrooms. There's a supermarket in Boulder that I go to that has the best gourmet mushrooms. But in general, if you just go to the general supermarket like the Kroger's or something, you can't really get those. But you can get the button mushrooms, which also have a great deal of potency. You mentioned Grifola, and that's not shiitake. That's maitake.
Oh,
Shiitake is known as Lentinus edula.
oh,
It's a
that's right.
little
Thank you.
bit tongue twister there. Um, but all mushrooms are really effective in improving our health. But and some of the things that help make them effective is their fiber They've got a lot of prebiotic fiber. They've got a lot of undigestible fiber that promotes a healthy immune function. But the fiber is so sturdy that if you eat a raw mushroom, it's basically going to go right through you. So
Mm.
I do recommend that if you're going to be feeding fresh mushrooms to your pet in a homemade diet or just as a supplement to their meals, that you cook them first, and you should cook them for at least 15 minutes. The
Mm.
best place for a mushroom to be cooked is like in a soup or a stew. And it's best if the mushroom, although it's nice to have kind of little mushroom shaped pieces in a soup, for your animals especially, they don't necessarily have that visual need for seeing the mushroom in the soup. Chopping them really finely allows them to be cooked through and through better, but also allows them to be more better, allows them to be absorbed better by the animal because they don't chew, and this way it's much smaller and better subject to digestion, which means it's better subject to absorption. In the many hundreds of years of, if not thousands of years of history of traditional Chinese medicine, and Ayurvedic medicine, mushrooms have been a very important part as an ingredient in many, many formulas. And in these formulas, they'll take the mushroom and they'll dry it and they'll powder it. But and the powdered mushroom is better than the fresh mushroom in terms of absorption. But but what they'll do is they'll take the dried powder and they'll put it in a hot water bath at nearly boiling,
Mm.
somewhere at nearly boiling temperature for a couple of hours. And that helps to bring out even more of the active potency that's in the mushroom when when you do it that way. And that creates what we call a hot water extract. And so that's important for, I think, your listeners to look for when they're looking for a mushroom product, is to look for a mushroom product that has been already hot water extracted.
Mm.
Because that way you know you're going to get more of that, more of the goodies. It's going to be more effective, more rapidly effective for you as well. So that's my answer to that question.
And for just some people who are a little bit more science based, is it the beta glucans that we're looking at? I mean, you mentioned a couple things about the immune system and the fiber, and are some of the actions of the mushrooms kind of, do they happen through the biome? Does the bacteria in the intestines have anything to do with the immune support, or is it all through like cell mediated immunity? Maybe you can explain a little bit about how they work, say for cancer patients or to promote immunity.
The fiber in the mushrooms is made up both of beta glucans, which you're very correct, and they are very important in terms of signaling our immune system to get it to wake up and do something right. But the other type of fiber is called chitin. And chitin is what makes up that hard skeleton that we see around crabs and lobsters and even fleas. And chitin is not very digestible by mammalian digestive enzymes, but it is very digestible by bacteria in the bowel. So you are also 100% correct in saying that some of the immune system modulating, the immune system benefits of mushroom fiber is due to its interaction with the microbiome. It is the perfect food for the microbiome, and the beta glucans also have a secondary role in addition to being food for the microbiome in that they stimulate the cellular mediated immunity to, again, you're correct there, to regulate the good versus the bad bugs in the microbiome. So it doesn't just have a passive action of being prebiotic fiber. It also has an active action of regulating which families of microorganisms will thrive and which ones will be destroyed or reduced in size. And we know that the microbiome governs so many aspects of our health, and in part, it governs it because there's a balance of organisms in the microbiome, some of which are so-called good, and some of which are not good. So we want to have more good than we have not good, and that creates a healthier immune system and environment in general. So,
Yeah, I mean, that's great. I wonder if we could talk about a couple of cases, say maybe a cat case and maybe a dog case, if you, we could either talk about it through research, like what has been done to, we have, cancer is afflicting so many of our patients now. It's one of our top causes of death, and dogs and cats. And I really feel like these mushrooms kind of hold the key to prevention on some of these kinds of things. Do you do you agree with that? And then if so, maybe we could kind of, are there any actual examples of cases that you've seen either in practice or in research that you could share with us?
Well, unfortunately, there are not very many studies in our target species of dogs and cats. There are a few. And
Mm.
in the absence of some of these controlled studies, I've been doing some pilot studies with mushrooms and cats and dogs and horses, um, trying to get some evidence. Certainly they're not the same as an objective double-blind placebo-controlled study, but it's a place to start as seeing whether it's a proof of concept that because these studies say, let's say, this mushroom is good for the kidneys, what's it going to do, in the kidneys of a cat? And I'm still, and so that's one thing I'm looking to
Mm.
do. At the same time, there are two studies that have been published in dogs with two different mushrooms. One is the turkey tail mushroom, and one is the maitake mushroom, the one you mentioned earlier in terms of the Grifola name. And those studies, showed some effectiveness. The other study I don't think was very well designed and didn't show the kind of effectiveness we'd like to see. But those were both for cancer. One was for one type of cancer we see in dogs called hemangiosarcoma. It's a nasty cancer of the spleen. And the other was for another nasty cancer of the immune system called lymphoma in dogs. So we do have information and it does appear that mushrooms for our pets will provide the same benefits that we've been learning about from studies in humans, laboratory animals, and also from epidemiologic studies. Now, epidemiologic studies are pretty cool. They have their issues too, as any study does, but they're pretty cool because what they do is they go to populations of people who commonly ingest mushrooms, like in Asia or Eastern Europe. We see a lot of that, and
Mhm.
they measure certain parameters in those populations. Maybe they find people that don't eat mushrooms and compare certain outcomes, like maybe longevity or cognitive function, with those people who do ingest mushrooms. And you mentioned before that you try to eat mushrooms a couple of times a week. And so
Mhm.
what they have found is that people that do regularly eat mushrooms every week, a couple of servings a week, maybe even one serving a week, was enough to have them be able to show improvements in cognitive function, or no loss of cognitive function, or improvements in longevity, or what they call all-cause mortality is how they kind of, you know, people, what people, dying from any cause at all. And the mushrooms have been shown to improve cognitive function and also to improve the to reduce the all-cause mortality risks in these human populations that were measured. So we also know that the more mushrooms you take, the better it does of whatever you're trying to do with the mushrooms. So those are some important rules that we've learned from studies. We've got studies in we've got mushrooms for cognitive function, for instance, and GI function. What that mushroom that would be primarily lion's mane, and lion's mane is currently the most popular mushroom in North America because of its ability to improve memory and because of its ability to improve dementia. And there's some studies with lion's mane humans that are early Alzheimer's patients that show improvements or stability, at least. It's not progressing, but at least it's stable. But these are for the early patients. Early intervention is the key with almost any of these nasty chronic diseases that you and I deal with, and detecting them first and then intervening. Providing wellness supplements is always a good idea, and the wellness supplements might cover those things, but it's good to get some early warnings about things because then you can really make the appropriate efforts to try to reduce that problem's progression. So mushrooms for cognitive function, but lion's mane historically, before we were able to cultivate it and get large enough amounts of it to use in research, historically and traditionally, lion's mane was used for GI function, upper GI,
Hmm.
gastritis, and esophagitis.
Hmm.
And we're seeing benefits also for the inflammatory types of bowel diseases, which include colitis and IBD, but also have a whole range of other lesser known inflammatory conditions that affect the digestive system. So lions, and it's very bland tasting. So if you're talking about giving it to a cat, because cats deserve this as much as dogs do, but they're a little more selective in terms of what they accept. It's very bland. Some people even say it's somewhat like lobster. Though it's kind of a joke. They would say something tastes like chicken. I was listening to a podcast yesterday, or a radio show yesterday about the iguanas, in cold Florida, and how now they're giving some recipes for cooking them. So it's just, anyway, I digress. So but that's lion's mane, and so lion's mane's a great mushroom to use, very safe, very good for immune system. I'll use it for GI cancers. Or neurologic cancers, because it affects both the nervous system and the bowel. And as you might imagine, as smart as you are, Donna, that means it affects the brain gut axis, which is something that we are always working with. This is why when you eat a meal, you can get brain fog, because the food generates these molecules. If you've got a microbiome that's out of balance, and sends these molecules to the brain that make you kind of foggy. Likewise, you can eat foods that make you clearer. So that's the brain gut axis. So that's lion's mane. Another mushroom to note is called cordyceps, and cordyceps is the caterpillar mushroom, although real mushrooms doesn't grow it on caterpillars, we grow it on rice. But it's gotten a reputation, and maybe some folks have watched that Netflix series that had the cordyceps fungus actually infecting the brains of people and making them become zombies and stuff. I watched
Oh, I never
15.
saw that. That sounds
Yeah, well,
fun.
it's probably better off. I watched the first 15 minutes, and it was all I could take. I don't like those zombie films. They're kind of
No.
weird. Anyway, but the cordyceps mushroom is known to be an adaptogen. And you know about herbal adaptogens. Adaptogens help the body to regulate stress, both internal stress in our own body and external stress. And it works through the hypothalamic pituitary adrenal axis, the HPA axis, which governs stress. The pituitary feels stress, sends a signal to the adrenal glands, which then secrete the stress hormones like cortisol to help manage and deal with that stress. So the cordyceps is really important for that. The other mushroom that is also an adaptogen is called reishi. And so the two of those together can be a very powerful combination. But cordyceps has also been found, and traditionally in Chinese medicine, is used to support the kidneys and to support the lungs. And cats and cordyceps, like lion's mane, is also very palatable to cats. It's a little sweet tasting and a little warming. I love it. I think it tastes a little bit to me like toast, actually. So it's also very bland. And the um, so because it protects the kidneys and can protect the lungs, as you know, our audience may not, that in Chinese medicine we consider feline asthma to be an imbalance between the kidneys and the lungs. So it's a good remedy for feline asthma, but it's also a good remedy for to help protect the kidneys from damage. And although I don't have the objective evidence yet, I believe that starting your cat out as a kitten on cordyceps mushroom, because it has immune system benefits and stress benefits, but it also has protective benefits on the kidneys, may be a way to help hedge that problem that we see as cats get older in terms of the chronic kidney disease. So I recommend the use of cordyceps starting with kittens. And one important thing to know about giving mushrooms to very young animals, like to what we call neonates or newborns, is that it's good for them. it helps to improve their immune system function, as well as help to protect them from things. And if you're using lion's mane, and most mushrooms have some cognitive benefit, but if you were to use lion's mane or cordyceps in that regards, it also helps with behavioral training. So in those early stages, you're trying to, train them to be good little citizens in your household. And the cordyceps and the lion's mane can help with that. But also, many people will choose to vaccinate their pets when they're just young like that. Sometimes they get vaccinated before they even have a chance to make a decision about it. But some animals, especially some that come from shelters that are stressed, are under so much stress that their immune system doesn't work properly to process the vaccine. So you give a vaccine which could have some adverse side effects, but it doesn't have any positive effects in terms of creating immunity. So there are several studies that show that the use of mushrooms in young dogs, there weren't any studies in cats yet, but in young dogs, if you precondition them with mushrooms first, that their vaccine titers and their protection from these diseases that we vaccinate for is much higher. You know, I advocate the use of vaccine titers, and I'm sure that you do as well, for those pets that get vaccinated. And I do think vaccinations are an important part of our preventative health approach, but we just need to be a little more reasonable with the frequency and amount of vaccines we do and when we get started with them. Um, and so, this way, for that patient who you do a vaccine titer for, and the titer comes up being insufficient for protection, what do? You just vaccinate again? My suggestion is to precondition them first with one of these mushrooms, really any mushroom, and for about a month, and then revaccinate, and it's probably going to work a lot better. So those are just a few examples of things that just these. I'm just talking about these two mushrooms now. And you mentioned cats, and so that's kind of why I gravitated towards the mushrooms that are much more palatable. Some mushrooms they're kind of bitter, they're kind of sour, they're not really the best taste treat. Some dogs don't care; they'll eat them anyway. Especially if mixed with food in a powder form. And some dogs do care. My own lab, Ollie, who tends to be sometimes a little bit emotional about food and which makes him a little picky about stuff. He will accept about a teaspoon of turkey tail powder in his homemade food every night when I make it for him. So he doesn't seem to have any issues with that taste, at least.
Yeah, I use the mushrooms from Real Mushrooms for the horses too. I wanted to just say we have 10 people that have joined us, and I have a couple of questions from the chat. But
Yeah,
one of the
we can
first
do
things,
that. I'm just being
yeah,
honest. I'm just talking.
okay.
Mhm.
No, you're
But,
great.
but I did want to say, let's go after we do some questions. Let's go back to cordyceps and talk horses and cordyceps.
Ooh, okay, I've got to
I
put
did
that
a
in my
pilot
brain.
study. I did a pilot study in horses
Well,
with
let's go ahead and talk about it now. Go ahead.
that
Yeah.
have. Okay, well, PPID is a disease of the pituitary gland in older horses. They say about 25% of all horses will get this condition. It's a posterior pituitary problem. And so it causes a shaggy mane, it causes a pension
Cushing's.
abdomen, it causes metabolic syndrome, Cushing's like symptoms. It also is a risk factor for laminitis, a big risk
Mhm.
factor for laminitis. And
Yeah.
so so a couple of my colleagues who are herbalists had been using cordyceps in their horses that had PPID in their patient horses, and we're seeing some success. So we did a controlled study where we gave each horse a tablespoon of cordyceps mushroom daily. And we did before, at the beginning of the study, before we gave them the mushroom, we measured their insulin levels, which tend to be
Mm.
off the chart with PPID, and their ACTH. And and then after 4 months of a tablespoon a day of the cordyceps, we remeasured those. Most of them had lost their shaggy coat. Many of them had improved attitudes and appetite, and their abdominal distension was reduced, and their insulin levels and ACTH levels returned closer to normal or to normal itself. So, another example of how cordyceps, and that's an example of the adaptogenic function of cordyceps because it's affecting that HPA axis. It's pretty cool.
Can you remind me, so was it a tablespoon twice a day of the cordyceps
A
powder, the real
tablespoon,
mushrooms?
a tablespoon
Once a
once.
day.
Now,
Okay, a tablespoon
that's
once a day. And then how many horses were in that study?
8. We used
Okay,
8 horses that were in 2 different stables. One was in New York State, one was in Virginia. Cindy
nice.
Reichenau, Joyce Harmon. They were the ones that
Yeah.
ran the studies for me. I totally trust them, in terms of
Yeah, that's
their
great
ability
because
to
that is a
represent.
nasty condition. Yeah.
Yeah, so I haven't written that up yet. I'm still. I've got so many
Wow. We
things.
get it right off the press. It's hot
I
off the
need to
press.
write it up as a white paper and then publish that. Now, for veterinarians who want to provide cordyceps to their patients, the best way to go is to buy it in bulk, in kilogram bulks from the parent company of real mushrooms, which is called Namex. And
Yeah,
that would be the
that's how
most
we did
cost
it.
effective way. And then you can repackage it for your
Yeah.
patients.
Yeah, it's a great, and that's, I can't believe only a tablespoon did that, Rob. It's amazing.
Well, I think less will work, actually. This is a
Wow.
highly concentrated extract. I used a tablespoon because I used the lowest dosing tier that I use for one stomached animals, um, and applied that to a 500 kilogram animal, and that's how I came up with a tablespoon. But you and I both know that horses are much more efficient in their use of
Yeah.
herbs and probably in their use of mushrooms. My suspicion is we probably could get by with a teaspoon twice daily, or two
Wow.
thirds of a tablespoon once daily, which would, cut the cost down by 30%.
For all of you people out there, any horse person you know, it just lives in fear of Cushing. So this might be something really great you can
I
tell
think it
your
might
horse
be a good
people.
preventive, for all we know.
I bet it is. Yeah, and it's just
Mhm.
all new. Well, we have a couple other questions. One thing is dosing. So when you give a cat lion's mane mushroom, or when you give a cat cordyceps, what would be your
Mhm.
dose, your average dose? And same thing with the dog, so we can just get those doses out there.
So one of the problems with dosing is, what are you dosing? There is a difference between products that are grown and extracted or manufactured by different companies. So that's where it gets difficult giving you one across the board blanket. In Chinese medicine, the use of mushrooms is historically hundreds of years old, and so there have been established a dosing regimen for dried and powdered mushrooms that aren't extracted. Basically, it's the amount of mushroom you would add to your soup when you do the hot water extraction, and that's based on humans. And they have the dosing is divided into 3 different tiers in terms of severity of problem. So for wellness, just general, the lowest tier would be 1 to 3 grams of dried powdered mushrooms for humans. For therapeutic uses, for something that maybe we want to use the cordyceps for, or maybe look at using the reishi mushroom for its antihistaminic benefits, then we might want to
Allergies.
use the therapeutic range, which would be 3 grams to 6 grams. And then if you've got a patient with cancer or a really nasty infectious disease like a fungal disease like coccidioidomycosis or blastomycosis or something like that, then you use the very highest tier, which is 6 to 9 grams. So what you do is, in herbal medicine, the way that we determine the dosage for children is we take the weight of the child and we divide that by the average weight of a human being, and we multiply that fraction by what is the recommended human dosage. And that gives you the dosage for a child. That's called Clark's law. So we're using the exact same law to decide at least what the starting dosage would be for mushrooms and pets, because we don't have dosing studies, so we have to kind of shoot from the hip with this. And so if you apply Clark's law to that, and you're looking at using the real mushrooms pet extracts, then it's basically it's even. So basically what this comes out to, if you're using the real mushrooms powders, or we also put some of the powders in capsules, is that you do about an eighth of a teaspoon of the powder per 10 to 20 pounds of body weight once daily for the wellness. For the therapeutic range, you go twice daily, and for the high range, you go quarter teaspoon for 10 to 20 pounds of body weight twice daily, once or twice daily. So it's kind of a shoot from the hip, but you can see the idea. You give more, the more serious it is. We're using dosages that are weight adjusted to the size of the animal, and we're also using dosages that are adjusted to the condition we're treating. So it's not a simple, just well, get one capsule twice daily,
No, that's
but it
great.
also depends on what company's products you're using. But I've worked these out pretty well for the products with real mushrooms.
No, and that's great. And a lot of times, what I've done too is once I've gotten, like, say, a cat's asthma better, then I can cut the dose back a little
Yeah,
bit. And
exactly.
usually it's after about a month or sometimes 2 months, I can kind of, yeah,
Yeah,
so I can
I
sometimes
recommend
give.
that too. And and if it doesn't work, you could always bump them back up again. But it's always better if you could give less to get as much. Do it. It's less
Yeah.
expensive. It's less stuff you have to get into the critter. You know.
So we had two questions. We had one on inflammatory bowel disease and somebody named June that was worried about doing a biopsy with her cat. I don't know if it was a cat or dog actually. I think I might
Okay.
not know that. And you mentioned doing lion's mane mushroom, giving lion's mane mushroom as a treatment for inflammatory bowel in a cat. I think it was in a cat. Can you refresh us on that one?
Yeah. So Jane, in addition to doing biopsies to differentiate between inflammatory bowel disease and in the cat, small bowel lymphosarcoma, because that's the
Yeah.
big confusion in cats. Is it
Yes.
inflammatory bowel disease, or is it some type of cancer that looks very much like that? There are also some blood tests that use cancer markers that are less invasive than
Mm.
biopsy. And I believe you can look at those same blood markers for dogs as well. So that would be one thing I would suggest looking into. That it may, I don't know, your circumstance. It might be that biopsy is really what needs to be done. But yes, so lion's mane is showing benefit with inflammatory bowel problems. Lion's mane would also be good if, especially with a cat, if this were small cell lymphosarcoma that's in the bowel. They're very
Mm.
very close, and I think sometimes they switch back and forth. So it'd be good for both, and because it's more palatable in the cat, that's also a good deal. But it's equally palatable and equally effective, in the dog. Anytime, I just mentioned dosing, and I should probably add a caveat to that. Anytime you're going to be dosing with these mushrooms, it's really a good idea to start much lower than we're suggesting, and just to make sure that the animal doesn't have a reaction to the food. And certainly with cats, you don't want to overwhelm them with too much taste to begin with. So you'll start with just a little bit, work your way up.
That's great. And then Lisa has a question, and she lives in South Florida, and she has a question about the treatment of heartworm. Have there been any studies about mushrooms either helping the animals handle heartworm prevention medications better? Like if you live in Florida, it's pretty problematic. Heartworm is, or have there been any studies about using these mushrooms for parasites in general, like maybe with or without conventional medicine?
Well, mushrooms have a long history of being used for intestinal parasites. Bloodborne parasites, I'm not so sure that we have a solution for that. And because heartworm disease itself can be pretty nasty to treat,
Yeah.
you
Hmm.
have to sometimes weigh the risks to the benefits of each treatment when you're making your decision as far as how to treat it. And I think that the risks, especially in South Florida, of contracting heartworm disease and all the issues that come with that is so much greater than the risk of. I don't think I'm saying that right, but what I'm saying is that I think that because the risk is so high in that geographical area where you are, I think the heartworm preventative is much safer than risking a unproven therapy to try to prevent heartworm. I know there are some people looking at some herbals to help prevent heartworm disease and whatnot.
Hmm.
And until I can see some good controlled studies that show that it works, I don't feel comfortable as a veterinarian making that recommendation, because above
Hmm.
all, I don't want to do any harm to my
Hmm.
patients or any animal that I give recommendations to. So sometimes it's better to take a little risk versus a big risk, and go ahead and use a pharmaceutical. If you use
Right.
properly the heartworm meds, especially if you're not using one of these big complexes with heartworm and fleas and ticks and all, but just
I know, it kills
heartworm itself,
everything.
yeah,
Oh my
is much better.
gosh.
I think some of these tea and flick,
Tick.
these flea and
Flea
tick,
and tick.
these flea and tick products do have much more risk associated with them. And my suggestion is if you need to use something like that, I would go back to the old legacy products. I wouldn't use these new ones. I'd use old Frontline or whatever,
I
the
know. It's,
it's just one agent, and most dogs do well with that. I think that it's the
yeah. And we're,
these new formula.
yeah. Yeah, I think parasites like be a whole new podcast. If you guys are interested in that, just shout it out in the text. Um, well, I was just going to talk to you a little bit about a specific case. I have a
Yeah.
dog with, yeah, I have a dog with lymphoma. At least we presumed it was lymphoma. I felt a big lymph node on the left side, submandibular, and then another vet a couple weeks later. And it's important to realize these cases change kind of week to week, but felt lymph nodes on that whole left side, under the scapula, big lymph nodes, and then popliteal in the back, but only on that left side. It's really interesting.
Hmm.
Anyway, I used a number of different herbs, and this is kind of going back because this was like 2 years ago, and we actually got, I guess you would say, remission. We used real mushrooms, 5 defenders, but we switched it up with turkey tail. I just wondered though if there might be, and we did diet changes and a lot of things, but I wondered if there might be some specific research on using specific mushrooms at which doses and things like that for lymphoma in particular. And if anyone in the chat has a question about that too, they can chime in. But what do you think about that, Dr. Rob?
Well, did they do an aspirate of those lymph
So an
nodes?
aspirate, yeah, they did an aspirate, and it was kind of inconclusive. It showed reactive cells, but they weren't necessarily high mitotic rate.
Okay.
And then she wasn't really willing to do another aspirate. I don't know that a second one. And then she never did a biopsy, which I think would have been even
And
better. But
there's some blood tests you can do now too that might be
yeah,
useful.
when they go into remission, do the blood markers still stay?
No, the blood
Okay.
markers get reduced because the blood markers are created by actively growing cancer cells.
Okay. Okay.
So if
Yeah.
they're
Well, we can certainly do those tests,
still,
but
yeah, that could be done. But regardless of this individual patient's exact diagnosis, and it may be that there's a reason why all the lymph nodes on one side were reactive, but not, cancerous, in terms of an infection or something that was going on in the left-sided part. And almost sounds like a job for homeopathy because don't some of those
yeah, I
remedies?
was thinking that too. I'm like, wait, I think I missed that. You're
Yeah, but
right.
anyway, but to answer your question, there, especially in our veterinary species, there's just so few studies that have been done into cancer and our patients and how we dose those. And one reason is that studies are costly, especially big studies that are, significant. And so you need to have funding to pay for those studies. And so generally that's where we get to see some of the bias in science, even though we do the best we can to reduce that bias, is when the funding agency, kind of dictates the conditions of the study. So for lymphosarcoma, two studies that were done. One was what we call an in vitro study, which means it was basically in a test tube or a petri plate where they had tissue culture cells from lymphoma from dogs, and they put this maitake diffraction in there, this maitake gold, and they were able to see that somehow these cancer cells were being killed by the beta glucans, I guess. So they tried several other types of tissue types. They had connective tissue types. They had mammary types, mammary tissue types, mammary cancer tissue types. There, I can say it. And they found that in the connective tissue and mammary tissue cancers, they slowed down the growth of the cancer cells, but they didn't stop it. So then what they did was they got a researcher, a veterinarian, to do a study, an objective controlled study that wound up getting published in the Journal of Veterinary Internal Medicine, um, using these maitake drops in dogs that had lymphoma, and they selected dogs that they thought had at least 2 weeks to live. So they were all end stage
Mm.
lymphoma patients. Well, I think it was stupid on their part, pardon my French, for choosing dogs that aren't going to live very long. Because guess what?
Right.
That's what happened. They had the study failed miserably because these
Mm.
dogs were on the verge of death. With treating cancer, treating anything, but especially something nasty like cancer, the earlier you get in there and the harder you hit it, the better your long-term results are going to be. Period. So they've kind of buried that study. You can find it, but they don't really talk about it very much.
Mm.
I think that, the flaw in that, I think probably the Maitake would be great, but I think the flaw was selection. They should have selected them
Mm.
at first diagnosis, and can be
Mm.
given concurrently with chemotherapy. There's a number of studies showing there's no interference of mushrooms with chemotherapy, a
Mm.
variety of different mushrooms, a variety of different types of chemotherapy agents, and they should have dosed it higher. And they were using a
Mm.
tincture, and tinctures are convenient. A lot of people want tinctures, but you can only pack so much potency in that liquid because
Mm.
50% of it has to be a liquid, to keep it soluble. So that's one reason why Real Mushrooms does not do tinctures, and we just do powders. Although we did just recently acquire a Japanese mushroom company that has that same maitake in liquid format. So I'm actually looking forward to getting my hands on it and
Mm. We'll have to do
trying it
another
out.
podcast about that.
Yeah, it's pretty cool. Yeah.
Hmm.
So, okay, so that was for lymphoma. Okay,
Hmm.
and that was kind of relevant to your question. So, in terms of, and the other study that we did wasn't in lymphoma, but it was with a mushroom called turkey tail that historically and traditionally has been considered to be the mushroom to use for cancer because it has the highest beta glucan content, has a really high terpene content, and it grows globally. So all around the world, these indigenous cultures that harvest their own mushrooms and make them into medicines and take them have found benefits for the turkey tail, especially with cancer types of problems. So they used this turkey tail extract for dogs with hemangiosarcoma, and they found that it increased their survival time, because it's a nasty disease and almost no one
Hmm.
gets out of there alive, increased their survival time with if they had no chemo at all, or if they did have chemo. So they found a lot of good things in the study. So in general, when it comes to cancer, generally, I recommend turkey tail. And for
Hmm.
lymphoma, I recommend turkey tail. Until I get more evidence that this maitake might be another choice, maybe we would use turkey tail and maitake together, in a formula or just separately. So, turkey tail is really what we recommend, and it needs to be given at a higher dosage. You need to start low and work your way up, but the dosing scheme that I mentioned just before would work very well for using turkey tail in a pet that has lymphoma or has other cancerous diseases. But you would start low. You would start maybe with an eighth of a teaspoon per 10 pounds of body weight twice daily and work your way up gradually to that quarter teaspoon twice daily to get a high enough dosage. And in addition to using the turkey tail, when you first diagnose the lympho, many people will go the conventional route and do the chemo for the lymphosarcoma. We know it works, but we also know the dogs come out of remission many times. And then they have to
Hmm.
find it. They use the same chemotherapy agent again, which works for a little bit, and then they come out of it. Then they use a different chemotherapy agent, then a different chemotherapy agent. Well, the flaw with that is they should be using the mushroom at the same time. And it may
Hmm.
be that once you get remission, if you continue to use a high dose of the mushroom, I don't have the clinical evidence. I just, from what I know about how this works and what I've heard from people for their own cancers and pets with their cancers, get that turkey. If you didn't do it for the chemo, or you're worried because you're going to upset your oncologist who thinks the mushrooms are awful, start the mushroom after the chemo when you're not involved with the oncologist to keep them in remission. It's worth trying.
Hmm. I mean, do you find that oncologists are more open than they used to be about the use of mushrooms? Because I see that around my neck of the woods is just A lot of times they are using turkey tail along with their protocols, but I'm not sure if that's true for everywhere or if there's still a lot of bias against the
Well,
holistic.
cancer is a nasty disease to treat, and we've got some good tools, but some of those tools have a lot of adverse side effects. So there are some oncologists, I know of about six now nationally, who who have taken the path of integrative medicine. So they're doing chemo, or they're deciding to do or not do chemo, but they're adding on to that nutritional advice, supplements, mushrooms, a variety of different approaches. There's new peptides they're using that can block certain metabolic pathways. So I think there are, and there's a really good oncologist in your area in Washington State, Luminita Sarbu, and she's great. She took my course on veterinary essential mushrooms, and she's been using her mushrooms as she can in her practice, and she's quite good at it.
Okay, well, that's great. Yeah, I certainly have heard of
You might
her.
consider having a podcast with her sometime.
Yeah, yeah,
She's
we definitely could. We'll see
Mhm.
how much interest people have on the cancer topic. I think there's a lot of interest, but
There's a ton of interest. Yeah.
and then another question, you mentioned reishi as a treatment for allergies, just that it has antihistaminic action. Can you elaborate on that a little bit? Do you use it in severe allergy cases and as your only treatment, or do you use it alongside, like, say, diet changes and other holistic
Well,
treatments?
allergies are complicated, as is cancer. I wouldn't use mushrooms alone for a cancer patient. So I wouldn't use mushrooms alone for an allergy patient. I think first, with an allergy patient, you need to find out what they're allergic to and see if there's any way you can avoid that. That's the simplest solution to an allergy. Not always that
Sure.
possible with environmental allergies, but could be possible with food-based allergies. Oftentimes, pets, people think it's one or the other, but oftentimes they've got both. They're an allergic individual, so they're going to have
Yeah.
reaction to food, they're going to have reaction to external things. So it should be used in a multimodal fashion, with diet change, with acupuncture, with Chinese herbs, with avoidance, with allergy testing, with your NAET approach, all those things are worthwhile doing. The value of adding the mushrooms is multiple. One, the reishi and the chaga, okay, both contain these terpenes in them, terpenes similar to what we see in cannabis, that are larger terpenes that will stabilize mast cell membranes, which reduces their release of histamine. So they're not really antihistamines, but they function like. Maybe not as drug-like or strong, but they still have that tendency. And the longer you use them, the longer they have, the better the effect they have. So, and these also are good with mast cell tumors because of that same issue, with stabilizing the mast cells. But the other way that they work, another way they work, is by regulating the immune system, because allergies are an immune system's a bit out of balance. It's reacting to things it shouldn't. So the beta glucans can help to bring that immune system back into better harmony, so it's not reacting so much to things it shouldn't be reacting to. And of course, not exposing it to those things helps to reduce its reaction, so it helps it to heal and cure itself. But then the third reason why mushrooms can help with allergies is their huge benefit to the microbiome. I mean, we are seeing now with fecal microbiome transplants that some dogs are actually being cured of their allergies simply with an infusion of feces from a healthy dog that doesn't have allergies. So the microbiome is a huge player in this. If the mushrooms can help to promote a healthy microbiome, either with or without fecal microbiome transplants, bingo. That's a good way to treat a very, very hard to treat problem that I know affects so many animals and people and makes their lives kind of miserable.
I'll say it's such a big problem when we're holistic veterinarians. It's probably one of the main things we see, right? We see allergies, we see cancer, we see all these chronic, nasty diseases, endocrine
Yeah,
diseases. You mentioned
yeah.
Cushing's in horses. Do you, I think I've talked to you about this before, but Cushing's in dogs? And how about acromegaly in cats? I went to BMX in the virtual room and I was like, wow, and they never talked about acromegaly in cats when I was in vet
It's
school.
so fucking rare. you know.
I'm like, what? Okay, well, they talked about it like it wasn't rare. I'm like,
By the
that's
way, what is
crazy.
acromegaly in cats? It's
Ac-
like it's unusual growth hormone
No,
production.
it's the kind of same thing you're talking about. The pituitary gland is a benign, they call it a benign tumor, but it's really just an overproduction of growth hormone that then
Yeah.
affects multiple areas of the body. And I kind of thought, God, I bet mushrooms, something that's working on the HPA axis and in those cases. Same thing with the dogs with Cushing's, I don't know,
Right.
they just seem like, and it might be kind of environmental chemical triggers. I'm not sure what's causing it, but we are seeing a lot of crazy cases.
Well, one thing about holistic vets like you and me, is that we've kind of learned to think creatively. When we learn a fact about something, even though we don't have the objective evidence that many of these, tight sphinctered evidence-based people are, we realize that it's not going to hurt, and if it might help where nothing else has been able to help. So I just learned something new about acromegaly in cats. I didn't really know it was a thing, but you're right. If it's being produced by those releasing hormones from the hypothalamic pituitary axis, to affect growth in general, then an herb that would have effectiveness in helping to balance that might be the way to go. So I don't have a study in dogs with Cushing's disease, but I'm certain that the cordyceps may not be curative, but I'm certain it's going to have a benefit for dogs with with classical Cushing's disease, and maybe even with the atypical Cushing's disease that involves the sex hormone production. And it may be possible to try it in a cat with acromegaly. When's the last time you had a patient that was feline? So if you
I
let's
mean,
have
it might be that we
think this.
have it and we don't know because it's one of the causes of diabetes. It was in the diabetes lecture for cats, and so it's like I didn't know that, but yeah, I just learned that.
Well, and speaking of diabetes, mushrooms themselves have a very strong influence on glucose regulation. And so, especially if you have a diabetic patient that is on insulin and maybe their regulation is not going so well, mushrooms might help improve the regulation, but you have to realize that giving the mushrooms may also affect glucose levels, and it may create glucose levels that might be a bit problematic. So if you are introducing a mushroom to a diabetic animal, and hopefully if you have a diabetic animal, you have a means of checking blood glucose at home, um, then I would check that blood glucose maybe a little more aggressively to make sure that the mushrooms aren't getting you into a hypoglycemic place that you don't want to be at, or a hyperglycemic place. And then if you're seeing it become more hypoglycemic with the mushroom, then that allows you to reduce the insulin dosage and, of course, measure those changes, because you may be able to creep down that insulin dose at the same time as you are adding those mushrooms to your diabetic or metabolic syndrome patients.
Yeah, they were talking about using the HGLT2 tablets, like the Bexacat type. Anyway, there's all of these
Oh,
new treatments for.
that's your oral anti-diabetic medications.
Yeah, and they're very effective, but they have to catch it super early. And I was thinking, wow, maybe if they add the mushroom, maybe there's a way to kind of add some mushrooms in or a different herb in to help with that. Maybe there'd be more cases they could use it for and they don't have to use the insulin.
So these must be like little peptides, very similar to all this GLP-1 that we're hearing so much about that also
Yeah, they stop the
stimulates
glucose from spilling into the urine, I think.
something like
So,
that.
yeah, or
Yeah,
something like that. I'm not an expert in it, but
that's
yeah,
beyond
it's
my
kind of
pay
cool.
grade.
It's new technology
Yeah.
for, I mean, not new, but just,
Yeah, but I saw those. I saw the ads. I was at VMX, and I saw the ads for
yeah.
these oral anti-diabetic medications for cats.
Yeah, I have a patient on one, and it's
Oh,
just
cool.
working great. Yeah.
Oh, cool.
So they caught it early enough, and it was just
Nice.
it's a cat that just won't eat healthy things. I don't know. It's okay. It's like
Some
once
cats
they
are.
get to a certain age, it's like, oh, I don't know. We can't fight with them.
Mhm.
Um, yeah, we have 21 people now, so that's really cool.
Oh,
Considering we
sweet.
had to change the time,
Do we have
my
questions?
fault.
Yeah, it's
Yeah. Well, we just Lisa had another question about just do these mushrooms help or have they been studied in humans? And I answered in the chat and just said, yeah, I think that a lot of the research comes from humans, but maybe you could talk a little bit about how the human research affects the pets and how the pet research affects, because there is a difference, I think, right? Or what do you
Depends.
think?
It depends on which research and what systems you're
Yeah,
talking about. I
she's
mean,
talking about it for
pets,
cancer, but
dogs aren't little people, but they have the same basic biology. So, yeah, as I mentioned, there's just very few studies, in veterinary species, like maybe two for cancer. Um,
right. So most of the information is from the human side.
Yeah, and so so
Hmm.
we're applying that. For instance, the turkey tail that I was mentioning before, that is a great mushroom to use with cancer. Um, there is a lot of research in the humans with this turkey tail cancer, and the company that has the patent on that turkey tail extract, a Chinese company, funded these two studies on hemangiosarcoma because they wanted to be able to have FDA approval of their mushroom extract to be used in humans for cancer. So they funded this study, this veterinary study. So that there is some translation between human studies and pet studies, um, and so and that's where I learn most of my information, is from the human studies, and that's where we try to translate it to the pets, and that's where I start with pilot studies, with farming, with talking to some vets who had patients with a particular problem, getting them to use a certain mushroom in a certain dose, giving them some time and seeing if they got some positive results. That's kind of what happened with the cordyceps study that we did in the horses, with Cushing's disease. Was we started with some anecdotal reports, and then I wanted to test it. So we're working on it. It takes
Awesome.
time, takes
It's
funding.
awesome. And you're
Mhm.
like a pioneer in this. It's just so awesome. I
Thanks.
have one quick other question, and that is about side effects or times when you don't want to use the mushrooms. Like you mentioned that sometimes the mushrooms can cause the glucose to change for a
Mhm.
diabetic cat. Are there other contraindications that
Well, I
come to
don't think
mind? Are
that
they
diabetics are a contraindication at all. I think diabetics are indication to use mushrooms.
okay? You just have to make sure that you're watching that
Well, you
glucose.
should do it under veterinary supervision. I
Yeah,
think
okay.
especially a veterinarian who's compatible with mushrooms. Mushrooms have very few side effects, and they can be used concurrently with chemotherapy. They could be used concurrently with most drugs. They don't interfere with liver detoxification enzymes, which is one of the main reasons we look at herb drug interactions or supplement drug interactions. Um, the only they don't really affect bleeding, but except if you use dosages that are probably impossible to give to a patient, were given to mice or whatever. But if you do have a patient on some very critical pharmaceuticals, anticoagulants or things that are critical to its life or health, then I would introduce, and in general we don't think that they have a problem, but there's always that individual in situation. So I would start with a much lower amount of mushrooms, and then I would watch the patient, re-examine the patient, look at the part of the patient that you're treating with the pharmaceuticals and see if that's being affected by the mushrooms. In general, you're not going to see that. The biggest side effects that we see with giving mushrooms, and some patients are very susceptible to this or sensitive to it, is that the high fiber in the mushrooms can create soft stools or diarrhea or general digestive reaction to it. And it does happen. It's a very small percentage, but it's real. I do customer service with real mushrooms, and we get hundreds of customer service calls about their pets, and some of them are complaining about the side effects that they see, the diarrhea or the soft stools or the
Never see
vomiting.
that.
But they stop the mushroom and it goes away. So I know that it was the mushroom that did it, and unfortunately, it may be that animal's not adapted to mushrooms, or maybe we need to start way, way lower, just a pinch, and gradually increase it to allow the digestive system to adapt to it. We also see allergy to mushrooms. Some animals have allergies. That's a defined entity in humans. There's something called a shiitake dermatitis, where people that eat shiitake mushroom break out in a rash. And we've had some customer service complaints about dogs that did develop rashes secondary to trying in small dosages, something that shouldn't really be a problem, a tiny little one single capsule the first time and they react.
That's
So
interesting.
yeah, they are pretty safe. They are basically a functional food, but just like some foods, some animals and some people have reactions to
Oh yeah, it can happen to anything. You could
them.
react to a carrot or anything. Okay, though that's good information. Thank you. And then just looking at the future of the research, do you see some? You mentioned the horse study that hasn't come out yet. We're so lucky to find out about that information from you. Thank you. And are there other, like, the direction of your research and sort of your vision? What do you see in the future, next few years, as far as use of mushrooms and even other alternative medicine in holistic medicine or in integrative medicine?
Well, I think with many of the, I think with our I think with our interest now and our understanding, our greater understanding of the microbiome, we're going to be seeing more supplements, more remedies, more mushrooms that have been proven to be beneficial for the health of the microbiome and subsequently for the generalized health and health span and longevity of humans or of animals. I've put in funding for a study to measure the benefits to the microbiome with mushrooms. I think that's a really important thing to establish with as much interest as we now have with the microbiome. And there are there are ways of improving the health of the microbiome without doing the aggressive fecal microbiome transplant. There's herbs and there's supplements and there's some new probiotics and there's different foods and there's mushrooms, all of which can promote a healthier microbiome without having to actually do that transfer. So that's kind of where my interest is. I'm sure there's many other interesting areas of research, but that's where I want to go with my explorations.
That's awesome. Well, thank you, Dr. Rob. You've been more than generous. Oh my gosh, we so appreciate it. All of us do. And for those of you who didn't get your questions answered or have other questions, just go ahead and start a comment section in at the end of this, and then I can look at it, and maybe we can have Dr. Rob back. We can coerce him into once I figure out what time zone I'm in. That would really help.
And we're only an hour apart.
I know, and why is that confusing to me? I swear. Anyway, well,
Well,
I
I
really,
think I think
I really
Donna,
appreciate it.
you're more of a visionary. I think you deal in the large vision and stupid little things like time. Who needs
They
it?
do, yeah. It does trip me up. I have to say, it definitely trips me up. I
Well,
apologize about that, but
consider yourself tripped.
well, thank you so much. I so
My
appreciate
pleasure.
it, and we'll be in touch soon. And we have a big clap from Lisa. Yay! Thank you so much.
See y'all.
Yeah.